So I first met Bob in the emergency room as he was transferred from a local community hospital in their area, and I spoke to Amanda on the telephone given it was an emergent situation, explained to her that you're going to be hearing from us daily because things will change on a daily basis. My name is Maddie Daglish, and I am a neurointerventional nurse practitioner here at Portsmouth Regional Hospital.
I had a lot of questions. I was really in shock. When I met them, I think they could sense that right away, that I really didn't know what to do with myself. I know that they could sense the shock and the emotion in me. They were so kind and so gentle the whole time. I think an ICU nurse is a very special breed because they deal with some very serious, stressful situations. They were so calm the entire time, and that helped me to stay calm, because to see your husband basically a comatose state, intubated, unable to speak or even open his eyes for the first couple of days. He couldn't move, he couldn't even squeeze my hand, and they were so reassuring the whole time. My name is Amanda Hoffman, and this is my husband Robert, and he was a patient here at Portsmouth Regional Hospital.
Bob came to the ICU. I took care of him early on in his stay. It was a very devastating injury. It's such a big deal to have a brain aneurysm that's ruptured and all the complications that can come with it. Family plays a huge role in patients' recoveries. They know our patients' normals, they know what they prefer, they know all the things about them before they come to the hospital. And in the ICU, we don't always know that. You know, having your family and your loved one around is so incredibly important.
Fortunately, I had never experienced a medical trauma like this before, so I didn't really have much experience in a hospital. And I think I was expecting it to be much more clinical and cold, and it wasn't that at all. They're like a family. The ICU floor is like a family.
The nurse is there specifically to take care of them and to be there for them, to be their patient advocate, to communicate with the family. I've been in this profession for 14 years now, 6 as a bedside nurse and 8 as a nurse practitioner. And even as a bedside nurse, you are there 24/7. There's always a nurse, even if it's 8-hour shifts or 12-hour shifts, and they know the comings and goings every hour of the patient.
Maddie never let me go without asking questions and trying her best to break things down into layman's terms. You know, Dr. Mazzari, I might only get 3 minutes with him in the day because he's so busy, and everything would go by so quickly, and she would come behind making sure that I understood what he said. She'd draw me pictures and sit with me for a long time, honestly, to make sure that I understood what was going on.
Since Bob's discharge here at Portsmouth Regional Hospital, I've seen him multiple times in the office for his scheduled frequent follow-ups. It's been great to see them and see how his outcome has been, you know, biking, planning on going skiing this year. I generally don't get to see these things. Brain aneurysms have about a 40% chance of not making it to the hospital, and out of the people who do make it to the hospital, the outcome can be very different for that population. And so to see a positive outcome out of such a devastating disease process is very heartwarming to see them come back in the office. Be very grateful to the nursing staff and to the medical staff as well.
As much as what the nurses did for me, I'm very, very grateful for all that they did for my wife, because I can't even imagine what she was going through during this whole period of time, to have her husband debilitated in a hospital.
Obviously, the surgeon and his team played a big role in stabilizing Bob and saving his life, but the nurses in the ICU, they are so on top of his day-to-day care, minute-by-minute care, honestly, in some cases, like Bob's case, just not knowing what's going to happen from one minute to the next. They were always right there to take care of him and to take care of me. What Bob experienced was a very unusual and stressful situation, and we are very thankful for the nursing staff here at Portsmouth Regional in being a huge part of saving his life. They're like a family. The ICU floor is like a family.